Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome or PCOS is an endocrine disorder characterized by a group of symptoms that affects the ovaries and ovulation. The main features of PCOS include cysts in the ovaries, high levels of male hormones, and irregular or skipped periods. PCOS is one of the common endocrine disorders in women of reproductive age. About 6 to 9% of women worldwide suffer from PCOS. In India, the studies report a prevalence of 3.7% to 22.5% and even up to 36% in adolescents. There are no known causes of PCOS, however, some studies indicate faulty genes as the cause. The signs and symptoms of PCOS are related to menstrual abnormalities, hyperandrogenism, obesity and metabolic syndrome, infertility, diabetes, and sleep apnea. Menstrual abnormalities in PCOS include abnormal menstruation patterns, oligomenorrhea, secondary amenorrhea, or dysfunctional uterine bleeding. Hyperandrogenism may be characterized by excess terminal body hair in a male distribution pattern, acne and male pattern hair loss. Most women with PCOS are clinically obese. Many women may have metabolic syndrome characterized by abdominal obesity, dyslipidemia, high-density lipoprotein cholesterol, elevated blood pressure, a pro-inflammatory state characterized by an elevated C-reactive protein level, and a prothrombotic state characterized by elevated plasminogen activator inhibitor 1 and fibrinogen levels. A subset of women with PCOS is infertile due to intermittent ovulation. Conception may take longer than in other women. Women with PCOS may have fewer children than they had planned. The rate of miscarriage is also higher in affected women. 10% of women with PCOS have type 2 diabetes mellitus, and 30 to 40% of women with PCOS have impaired glucose tolerance by 40 years of age. Many women with PCOS have obstructive sleep apnea syndrome, which is an independent risk factor for cardiovascular disease. PCOS can be diagnosed using the criteria proposed by National Institute of Health, Rotterdam criteria, and the Androgen Excess and PCOS Society criteria. PCOS is a diagnosis of exclusion. Certain laboratory tests may be needed to rule out other probable causes and also determine the hormone levels. Imaging tests such as ovarian ultrasound and pelvic CT or MRI may be needed to visualize the ovaries and adrenals. Certain lifestyle changes, such as diet and exercise, are considered first-line treatment. Pharmacologic treatments are reserved for metabolic derangements, such as anovulation, hirsutism, and menstrual irregularities. Weight loss and increased exercise in conjunction with a change in diet consistently reduces the risk of diabetes and also restores ovulatory cycles. Weight loss in obese women with PCOS also improves hyperandrogenic features. Other interventions include moderate physical activity, no smoking, low-calorie diet for weight reduction, and omega-3 fatty acid supplementation. Medical management of PCOS is aimed at the treatment of metabolic derangements, anovulation, hirsutism, and menstrual irregularity. Medications used in the management of PCOS include the following: oral contraceptive agents, anti-androgens, hypoglycemic agents, selective estrogen receptor modulators, topical hair removal agents, and topical acne agents. There is no cure for PCOS, but with lifestyle changes and pharmacotherapy, the condition can be managed effectively and the complications can be prevented.